welcome. This video is right for you if you are pregnant or thinking about becoming pregnant and you would like to learn some tips and tricks on how to have as easy as a pregnancy as is possible for you. My name is Dr. Lane Morales and I'm the owner of Pure Light Chiropractic. At Pure Light, we focus on pregnant women, and both of our practitioners are also trained in Webster technique. This is a technique that is specific for pregnant women, and it's to help them have as much ease as possible during pregnancy. What I would like to get out of this video for you today is I would like to explain to you what happens to your body during pregnancy, and then I'd like to explain to you how chiropractic can help with that, and then also give you several tips to do at home that will hopefully help you thrive during your pregnancy. So I'd like to get started here with this picture of your spine here, or this model of your spine. This is your spine and this is your pelvis. This is the front, this is the back. When you become pregnant, what happens in those short 9 months, in those 40 weeks, is that your pelvis will start to change shape. So we want the baby to come out through here, and as you get more and more pregnant, your pelvis actually opens up. Your body has a lot of relaxin in it, and relaxin is a hormone that's going to loosen all of your ligaments and joints, and that's because the pelvis has to be pretty pliable, because during childbirth the pelvis opens up and the baby comes out through here. So this is your sacrum here in the back, and it moves out of the way. And this is your pubic bone here in the front. There's actually a disc in here, and it may separate a little bit. And this is all normal mechanics to get your baby out of your pelvis. So that's what's supposed to happen. But when you get a bunch of relaxin, what can happen is that your body can be more prone to traumas or discomfort because it just doesn't have the strength or the integrity that it used to have. If you look at this picture, this pregnant woman, her center of gravity starts to change. So now the weight of her body is here, and in order to compensate for that, she tends to roll her shoulders forward, her head moves forward, everything kind of leans forward, and then she gets this huge sway in her back. And these are normal, but they can cause discomfort in your spine or in your body. Also, what I like to tell people is that when you're pregnant, all of your old issues will come back to haunt you, because let's say you had an injury in your hip. Maybe your body put down some extra scar tissue, maybe your body learned how to compensate for it, but now your body is changing, it's loosening up, it's changing shape, it's gaining weight. There's big changes that are happening, and when that happens, now your body has to adapt to something new, and that old pain might pop up because your body has to restabilize around it, and it has to learn a new way to compensate. And so that's a real common thing that happens during pregnancy, and that's why pregnancy is so hard. Is we have all this relaxin in our body, our bodies are not stable, our center of gravity changes, our posture changes, we gain weight, and so there's just a lot going on with our bodies. What we do as chiropractors is we make sure that your pelvis stays aligned. And so what can happen when you're pregnant is that one of these joints can get stuck. Well, actually you have several joints in your pelvis. You can have this joint, this joint, this joint, this joint, this joint, or this joint, and one of these joints can get stuck. When it gets stuck, then the rest of your pelvis is going to compensate. So let's say this joint gets stuck. Now the rest of your body is going to try to compensate for that, and you may get torsion in your pelvis or twisting. That can close the pelvic bowl or make the pelvic bowl more narrow or in awkward shape, which can affect positioning of baby, and it can also affect your comfort levels. When this is stuck, what could happen is that you could be overusing this side, so it gets inflamed. The muscles might be tensing up over here, which could press on nerves, which can cause pain down your leg. Or because it's so stuck here, this joint starts to overcompensate, and then you can have pubic pain. These are all super common ailments during pregnancy. And so as chiropractors, what we do is we practice the Webster technique, and that's just a way to assess your pelvis, get it to start moving again, get the joint, whatever joint is stuck, to start moving, which aligns your pelvis, relaxes the muscles and the ligaments around your pelvis, and then hopefully that will help you have an easier pregnancy and a shorter birth and a proper position for baby. And so those are really the goals that I have as a chiropractor for you. Ways that you can help yourself to keep your pelvis aligned are one, the first thing you want to start to do is listen to your body. It's really hard to listen to your body when you're pregnant because your body just can't do the things that it used to be able to do, which is normal, but it's not easy mentally. So if you always do the same exercise routine, you're probably going to get worse and worse at that exercise routine, and that's normal. But it's not. It's going to feel like it's difficult, and I promise you, you'll be able to get back to it in the future at some point. But listen to your body and slow down. Don't try to push yourself. If your body's really tired, you might be going through a growth spurt. Your baby might be going through a growth spurt, and so if you can, rest. If something hurts, don't try to just push through it, because with pregnancy, that's not really how it works. It's much better to listen to that and to slow down and to rest. And the more you learn how to listen to your body, the easier your pregnancy is going to be. So that's the first advice I can give you, is just really start to learn how to listen to your body. The next advice I'd like to give you is to learn how to get involved in some sort of exercise program. So your pelvis has all these muscles around it, and if they are strong, then they're going to hold your pelvis together, which will keep it lined up. And it also is going to help with childbirth. So when childbirth is a marathon, whether it's 4 hours or 54 hours, it is a marathon, and it's hard on your body. And the stronger your muscles are, the easier chances you are of having a successful birth the way that you want it. So I would definitely recommend strengthening your body. If you can't do that, then just make sure you're walking. Walking is great. If you can join a prenatal yoga class. You can do prenatal bar. There's prenatal workout courses online, prenatal Pilates, anything like that that's going to be focusing on strengthening your pelvis and opening it up. But I really recommend getting a good professional and also listening to your body, not necessarily doing everything that the exercise program tells you to do. If you can't do that, remember to go walking, and then you can also start to do squats. And so I'd like a deep squat down where your legs are pretty wide, and then you squat down as far as you can and try to hold that for up to 3 minutes. That will help to strengthen your glutes and your pelvic floor, stretch your pelvic floor. So that's a good option. But in general, go find a program, follow the program, or go find a teacher and follow that teacher. Other things you can do are to pay attention to the way that you're standing. When we stand, we tend to stand on one leg and kind of jut our hip out and lean to that side. And when we're doing that, we're focusing on our bone structure to hold us up. But now we don't have that strength of our ligaments, and so what that can do is cause shearing of the pelvis. So if you have a lot of pressure on this side, because you're standing on this leg, then that can cause this like shearing force in the pelvis, and that can cause a lot of pubic pain. And so my advice to you would be to definitely make sure that you are standing with your legs just a little bit wider than feels natural to you, and the wider your legs are, the more you're going to use your muscles to hold you up. Additionally, if you look at this woman again, it's so natural to lean our bellies forward because it just feels better. But what that can do is it can crunch your low back. It can put a lot of pressure in this area. And so what I would recommend is paying attention to the way you're standing and try not to stand this, with this much sway in your back. So what you'll want to do is you'll want to kind of tuck your pelvis or pull your pubic bone up. And when you do that, it will help to protect your lower back. So focusing on the way you're standing is helpful. And then focus on the way that you're sitting. When we're pregnant, or maybe all the time, a lot of us have big couches. We tend to slouch on the couch. So we'll sit on our sacrums. We'll sit more like this with this rounded spine like this. And what that can do is press on your sacrum, which will make your pelvic bowl smaller, and that can affect the positioning of the baby. So I recommend sitting on your sit bones, which is just like proper posture, where you're kind of like in an upright position while you're sitting versus a slouched position. So that's really helpful with sitting. In addition to sitting, try not to cross your legs or sit in a really awkward position where you have one leg up or something like that, because it's just going to put that torsion in your pelvis again. And then the other one is sleeping. When you're sleeping, you want to, you're going to lay on your side. I know that there's a lot of recommendations to lie on your left side, and there's a lot of great reasons to lay on your left side, but if you are only sleeping on your left side, you're probably going to end up with shoulder pain and hip pain. So I recommend listening to your body and switching back and forth as often as you need. But if you're on your side, you want to have a pillow that's not too thick. A lot of times, when you're on your side, you want your head to be neutral or even down a little bit. So if you have a thick pillow that's pushing your head up like this, you're probably going to end up with neck pain and maybe some shoulder pain in there as well. So make sure you have the proper thickness of your pillow. And then I am a big fan of body pillows when you're pregnant. So any kind of pillow that you can hold on to and also put between your legs, because that's going to help line your pelvis up as well. If you're a stomach sleeper, make sure you really tuck that pillow close to you, and then you can maybe lean on it a little bit, which will make you feel like you're on your stomach, but you'll still be safe. If you're a back sleeper, you can get a pillow behind your back. You'll if you're on your side, to wedge it in your back, and that way you can lean back a little bit, but you're not all the way on your back. And so those are nice little tricks. Another idea would be if your belly is big but kind of pulling when you're on your side, then get a pillow for that. So that'll just help align your pelvis as well as your whole body. And then really it comes back to listening to your body and listening to, yourself, because the more you can rest and the more you can take care of yourself, and the less you can stress out, then the easier your pregnancy is going to be. Something that chiropractic does when you get adjusted is it helps you connect back to your body, because it's really working with your nerve system. Your nerve system controls your body awareness, and the better your nervous system functions, the more aware you are of your body, and that's one of the big bonuses of regular chiropractic care. And so what that would look like is that you might notice, oh, I was feeling great, and then I started standing like this and I didn't feel great, and then you'll learn to listen to those cues that your body are telling you, which is to stop doing whatever you're doing. So what I would like to offer anybody watching this video is a free 15-minute telephone consultation. There are a million different ailments that you can have during pregnancy, and if you'd like to give me a call and talk to me for about 15 minutes about your specific ailment, I could hopefully give you some advice or some tips or tricks to do at home that will help you. What you can do is go to our website, www.purelightchiro.com, and just contact us. You'll find a way to contact us on there, and ask us if for that 15-minute consult, and I'd love to help you out. I know that pregnancy is this amazing thing. There's a lot of anticipation, but it's really hard on our bodies, and so the more self-care you can do during this time, the better.